Recording and okay. So this is the letter. This I have taken from this benchmark. And the first line is that I'm a cardiologist and I'm writing back to the GP of this patient. Okay, here is the task. Okay, and that I'm writing to this Mr. Kalab Abbas, GP private clinic. This. I've written the address over here. So, and see in the exam also, as it's written over here, today's date. So in the exam also, it will come like this. So there is no need to get confused. See, today's date is 18/11, and the last visit which we are having in this exam is in this letter case notice 17. So everything will be in the past. Okay. Or if we will just go. So these are the details. This I have mentioned here. Now, as this is I'm writing this letter to a GP. I'm discharging this patient. I'm a cardiologist and I'm discharging this patient to a GP. So I will not include all this medical history or this, I will not include. Okay, so this is gone. Now what's left? Now these things are left. Again, medical history is also gone. Now the subject is on the 14th. This is the date. Let me close this, wait. Okay, so this is the date when the patient came first. Okay, now we will just write the introduction. Okay, then what was the patient was having? Okay, she was having heavy perspiration, vomiting, and this pain, chest pain, in the epigastric region and the jaw. Okay, then this was the management, and then okay, chest pain increased. GCC was this, ECG showed this, and anterior wall MI, like the patient was having myocardial infarction. Okay, and then she was managed, and then on 15th also, okay, this is the same. Anterior wall MI, and on the 17th, chest X-ray was clear, echo was this, chest pain was mild, shortness of breath was improved, speech was normal, ECG okay, prominent Q waves, management continue, medications and oxygen, diet this. Now I'm just going to write a okay, today's is also given, I think so. I should have cropped it from here. It's very long. Okay, today's is also given, condition stable, echo this, patient requested to go home. Okay, patient has requested to go home. Plan is to discharge today. Then continue aspirin, this. So I'm writing to discharge this patient. So what can be the introduction? The introduction can be, we can write it in two ways. Okay, either we can update the GP, or we can write refer also. Both are correct. Okay, you can write it. Okay, I'm writing to update you about what's the name of the patient? It's Sabrina Jagosh. Okay, you can also write, okay, I have I'm writing to update you regarding, yeah, update you about, but regarding will look nice and much better. Okay, I'm writing to update you regarding. Take it, it's Miss Sabrina Jagosh. Now, what you can write is, who is now ready to be discharged today? Yeah, who is ready to be discharged today under your care? Okay, following being treated for a myocardial infarction. Okay, now I have mentioned everything that, okay, fine, who is now ready to be discharged today and back into your care following the treatment of myocardial infarction. Or you can also write here, if you want to write in the introduction, who was admitted for myocardial infarction. She is now stable and is ready to be discharged back into your care. Your further management will be greatly appreciated. Okay, these are the two ways in which you can write, but I will just go with the first way because that is compact and concise. Regarding the admission, I can, just mention it in the further paragraphs also. So I'm writing to update you regarding Ms. Sabrina Jagosh. Okay. Who is now ready to be discharged, who is now ready to be discharged today under your care, following being treated for myocardial infarction. M here, it will be small. Many people do this mistake. They write the M capital. No, you don't have to write the M capital. You can see this is also one of the way to write this. This although it's a discharge letter, but you can use this word update. There is no issues, or you can use this. You can also use refer. Okay, I'm writing to refer. Take care, Miss Sabrina JAGOSH, who is now being ready, who is now ready to be discharged back into your care. Also, you can who's now who's ready to be discharged today under your care following being treated for myocardial infarction. This is the simplest introduction that you can write, but you can also write it as I'm writing to refer Miss Jagosh, who was admitted for myocardial infarction. She has been stable now. You can say, okay, has been stable now and is ready to be discharged. Okay, your further management will be highly appreciated. Okay, now starting the paragraph. Now the first day she came was on 14th. Okay, this is the 14th. Now you can just write. Okay, now you can either start the paragraph with on 14th or this, or you can say, okay, initially uh on for again you can say, okay, fine, or you can say just 14th because that was the day when she was admitted also. So you can either start, okay, Miss Jagosh presented with presented to the emergency department on 14th, or you can say on 14th. Okay, both are correct. So I will just go with Miss Jagosh presented with the. Now here again, emergency department will be small, and you can just write. It's written here ED. Try to write the full form. Emergency department on 14/11/2021. Just write to 1. Okay. Now, with, you can write with also, or with complaints of. Okay, so with what she presented with what? Left-sided chest heaviness, pain, which was radiating to this, along with heavy perspiration, vomiting, and hair. Okay, so you can just write it over here. There are now 2 ways. I will just write it with one way, and I will just let you know the other way also. Presented with left-sided chest pain and heaviness. Or I would just write left-sided chest heaviness first and the pain after, because I would just mention also that chest heaviness and pain which was radiating to the left arm. Sorry, the left arm, jaw,
सीधा कर ली कुर्सी अच्छी खासी टेढ़ी
jaw, epigastric region, along with heavy perspiration and vomiting. Okay. Now, I can write it like this also, or you can just write all like this also. On 14th date, Ms. Jagosh presented in the emergency department with complaints of the left-sided chest heaviness and pain, which was radiating to the left jaw, arm, and epigastric region. And she was vomiting severely. But I find it like this, it's much better and nice, along with heavy perspiration and vomiting. Heavy means okay, fine. She was vomiting severely and everything. I've mentioned this. Now, this done. Okay, now I will just move to the examination. Then I will write it over here. On examination, she had what are the positive findings? I will see. Okay, abdomen is non-tender, pulse is this. Okay, and then she was done this. Or now, as you know, I have not mentioned over here the air hunger, so I can mention that air hunger in an examination also. Okay, I can write over here also that okay, she was, she had air hunger. On examination, she had air hunger. Okay, and there is no other finding. If I will just go with that, just a second, I will just. Air hunger means it's shortness of breath, or she was having a difficulty in breathing, like she was gasping. Okay, so on examination, she had a air hunger. You can write okay, or you can just write okay, she was having shortness of breath, or you can just also write it. See, now the saturation is 91, so she is hypoxic. Okay, and she's having this pulse rate of just a second. Today I'm having a lot of disturbance, sorry for that. Okay, then abdomen was non-tender, I can mention that also. Okay, fine. On examination, and she see, if you want to use synonyms, you can use that. You can also write okay, fine, her pulse rate was this, but you can also use synonym also. You can use okay, you can say okay, fine, she was having tachycardia, because see, her pulse is 112. Okay, and her she was having hypoxia, her oxygen saturation is 91. Okay, that's low. And her blood pressure was raised. Okay, so you can just write this also, hypoxia, and this, you can write that also. Okay, or if I just go, she had air hunger, and I will just write tachycardia also over here, because instead of writing the value, I chose to write okay, fine, because I understand that her pulse rate is right. So it's uh, she was having tachycardia, and this, and along with, I will also write along with hypoxia, if you want to use synonyms. Otherwise, you can just write okay, fine, on examination. You can write okay, she had a pulse rate of 112, a respiratory rate of then you will have to write the full okay, respiratory rate was 25. Okay, so you can write that also if you want. And if you want to use synonyms, you can use this also. Okay, she had ear hunger, tachycardia, and tachycardia along with hypoxia. Okay, now now that's done. Now my this one is done. Okay, or you can also write, okay, abdomen is non-tender, it's negative. So if I'm a cardiologist, I don't think so that's something very important that I have to write. No, now we'll just move to the management part. I will just go away here. Why this is not moving? Okay, now the management is okay. Then I will say, okay, she was started on oxygen. So first thing was oxygen. In the bracket, you can write it is 10 liter. She was started on oxygen, comma, and morphine. Again, M will be small. And what was done? Diagnostic workup was done. And some investigations were ordered. Some investigations were ordered. Okay, now full stop. Then now the positive findings. I can also say, okay, ECG revealed, or you can also write her ECG revealed. Both are correct. Okay. If you want, you can write the full form also. ECG revealed T wave inversion and prominent Q waves. Okay, and it was shifted to CCU immediately, vomited while transfer. Okay, now you can see this one thing, diagnosis anterior wall myocardial infarction was also made. So this I can write it over here. That okay, fine. The ECG revealed this is now. If you want to make a a new sentence, you can make a new sentence. Although these findings were suggestive of anterior wall, myocardial infarction, or you can just continue it like here also. Q waves. Q wave. Wait, where is this line? Q wave suggestive of what? Myocardial infarction. Okay. As a result, if you want, you can use you can use as a result, or you can use subsequently also. As a result, she was shifted to CCU. She was shifted to CCU for further monitoring. For further so this is also the way in how you can write. The other way you can write, okay, the examination also, you can just say, okay, on examination, she was perspiring heavily and had air hunger. Okay. She had a pulse rate of 112 and breathing rate of 25. Oxygen was administered. Okay. Again, did you notice something over here that, okay, here, there are some kind of articles are just reported to ED. You have to write the. Then again, the chest also you have to use the article over there. And here also applied. You usually administered, or if you're writing this applied, then you have to this again you have to write this face mask, although that okay, oxygen was administered via a face mask. Okay, so you have to take care of that. These kind of sentences, don't just copy paste whatever is written in the case note. They have just written it haphazardly and everything, and you have to write in a formal language. Okay, oxygen was administered at the rate of 10 liter per hour. Okay, now per hour is not mentioned, but okay, it's obvious, you can just write that in that way also. Okay, that but what I think is it will take a lot of words. Okay, it per hour. Okay, via a face mask. Okay, you can just write that also if you want to use the face mask also, that oxygen was administered at the rate of 10 liter per hour via a face mask, comma, um, IV morphine was also administered, and the ECG revealed, okay, prominent Q waves and T wave inversion. Okay, therefore she was shifted to ICU, CCU, okay, or ICU, whatever is there. But I think so. This just to write it like this is compact and small. Now we just come to the another that is the 15th. Now it's the same day. Sorry, it's the next day. So you can just write okay the following day or the next day instead of writing the date again. Okay, it looks nice. You can write the date also if you want. Okay, fine. On 15th this was our update, on 17th this was our update. You can just write that also, but again you can use the next day or the following day. You can use that. Okay. Now if you just read the 15, chest pain increased, speech slurred, GCC 15, ECG again this anterior wall a myocardial infarction was confirmed. Management plan, she was again started on oxygen, and this aspirin and this was given. ECG was requested along with chest x-ray. Now her condition has deteriorated. Okay, her condition has not improved but deteriorated, so we can just write that also. Or you can start with okay fine, the next day her condition deteriorated or something like that, but you can just use these kind of sentences also. I will just write it, and then I will let you know the other way how you can write also. Okay, so here is the this is the way. Okay, find the following day means the next day. Okay, find the Miss Jagosh condition further deteriorated. Okay, and deteriorated, and ECG showed this, showed ST elevation in multiple leads. You can just write this in a new sentence also. Okay, further deteriorated. You can, I will just make a new sentence. Further deteriorated, full stop. ECG showed ST elevations in multiple leads. There is no need mention. There is no need to mention the leads. But if you want, you can mention. Again, you are writing to a GP, so it's not that relevant because GP will not understand the leads. But yes, if you were writing to a cardiologist, then you have to mention the leads in which it was deteriorating. But again, if you want, if if you can manage, you can just write the leads also. Then again, the diagnosis of anterior myocardial infarction was made because over here, we were just having a question mark. We were just suspecting it. Now the diagnosis was made, and then TPA therapy, clopidogrel, as well as this was administered. Okay, were commenced. Or okay, now we are coming to the 17th one. Okay, regarding this article, I will just mention in the group. Okay, and I think so I have already mentioned it in the group. So, and this is also the way you can write the today's visit, but you also can write it. Okay, on the following day, Miss Jago's chest pain, because instead of writing condition further deteriorated, you can just write her chest pain increased along with what, slurred speech. Okay, ECG showed ST elevation in lead. Uh, these let you can write. Okay, and okay, and therefore her oxygen was increased to 15 liter per minute. Okay, you can write this also if you want. This, and here also if you want, you can write this also. Myocardial infarction therapy, this is were commenced. Okay, as well as you can as well as aspirin were commenced. Her oxygen, you can write it over here. Her oxygen was increased to 15 liters. You can write it over here if you want. I just missed that. I didn't see that over there, but you can just write that also. On the following day, Ms. Jago's chest pain increased with slurred speech. ECG showed ST elevation in this leads, and therefore her oxygen was increased to 15 liter, 15 liter, and clopidogrel and aspirin this were commenced. Okay, now we are coming to 17. Now if you want, this I have mentioned about the 15. Now if you want, you can write that also. Okay, fine. 2 days later, her condition improved with prominent Q waves. Prominent Q waves in on ECG. However, echo showed echo. There was echo also, I think so here. Okay, mild improved. This management. Okay, fine. This echo repeated, stable, patient now discharged, and this. And today's date is also this. Okay, so you can just write this also. 2 days later, if I just go 2 days, which is 18th. Okay, you can just write that also, or you can start a new paragraph and write, okay, today. Okay, because 17th, you can if you want, you can just fix it in that, or you can just make a new paragraph. But it's better, all the hospital visits, just mention it in one paragraph. It will be very easy. Now I'm just coming to today's paragraph. Okay, today I will just come, or I will just write it over here. Today, if you want, you can. Okay, now there are two ways to do this. If you want to include this also, and you want to include this also, you can just mention it over here. Okay, and then you can skip the today's visit. Okay, and you will just write the request which you are going to make to the GP. Okay, or you can just make one paragraph over here that, okay, fine, one more 2 days later, this her condition was this everything over here. And then you can just mention, okay, fine, she has been advised, whatever she has been advised, like to continue aspirin, and to quit smoking and alcohol. This things you can write. You can make a one paragraph of that also, and you can just write that also. If you want, you can, we can just mix this paragraph. I hope you're getting my point about the mixing this paragraph. Like, if, because in the discharge letter, it's the patient, the day the patient was admitted. Okay, you would just write the whole story, what was done on the day of her admission, what was that the diagnosis was made, and what the treatment was given. Then the second paragraph will be the what was done during the hospitalization. Okay, and the third paragraph, how she's doing now, and what advices has been given to her, and how she's going to be discharged. Okay, so these are the three paragraphs you have to make, and you have to proceed with that. Now, if you want, if you that is also fine. If we can just go, okay, fine, 2 days later, her condition improved. Okay, with prominent, you can see over here, with prominent Q waves on the ECG. Okay, and her echo was repeated also. Okay, echo showed anterior echo. Okay, echo was repeated and swore. Yeah, there is nothing over here. Okay, about the echo, if there is any finding. Yes, there is no finding. If I'm just missing, then let me know, if, because I cannot see. Okay, if you, okay, ejection fraction, you can say, write it over here. Okay, fine. Today her echo showed an ejection fraction of more than 50%. You just, it was the echo showed, so you can just write it over here, in this also, over here. Okay, if you want, but I'm just going to make a new paragraph and write it there. Okay, so uh okay, see, here I have written this new line. I have mentioned mentioned over here. I have added this one line. because I was just thinking that it's better that we just include this line. If you just here see over here, I just mentioned till 15th. Okay, the following day she was having this, and then it was this. What was her abnormality? That okay, fine. She was the echo showed what anterior abnormality, and the shortness of breath was improved, chest pain was mild, and then repeated ECG showed prominent Q waves. Okay, and the same, it was, continued medications and oxygen, that was the same as above. So I didn't mention that. But if you are writing to a GP, it's not, if you can just exclude that because you are writing to a GP, okay? But if you're writing to a cardiologist, then it's very necessary for you to mention this information. So what I have written it over here is 2 days later, that is the 17th, her condition improved. Because her condition improved, her chest pain is mild and shortness of breath has been improved. Okay, with prominent Q waves on the ECG. Okay, however, echo showed what anterior wall abnormality. Okay, now I have what now you will see that, okay, fine, okay, I will just discuss later. Now this is the today's paragraph. Okay, today, now what is happening today is that okay, condition is stable. ECG, her showed 50% of fraction. Okay, and sorry, echo showed 50% of fraction. She is stable, and patient requested to go home. Plan to discharge today. Continue this. Okay, and this. Now you can just write it over here also. Um, you can write it over here. She has been prescribed to take. Now, what the medicine, I will just write it over here. This Rovista and a card. Just a second. Okay, so I'm just mentioning it over here that now today Miss this okay, and she has been advised to quit this beside consuming a diet low on fat, salt, and carbohydrates. She should also walk for this 30 minutes, and she has been prescribed to take Rovista. Okay, now we are just going to write the conclusion. Now we'll just write, okay, in view of the above. Ms. Jagosh. Now, if you want, you can write this also. If you don't want, you can quit this also. Everything is not going in my favor today. I just, it took so much time to write this letter because I'm so occupied with everything today. It's taking time. Okay, in view of the above, Miss, this is being, if you want, you can just omit this from here. Because we have mentioned over in above, we also have mentioned that she's being discharged today, is being discharged back home on her request. Okay, because she's going on her request. Okay. Okay. Then I have mentioned over above that I have mentioned that what she is going to take and all. Now, what I would greatly appreciate now in the introduction. Okay, I will just give the explanation later. I will just finish this, then I will come to that. I would great if you could monitor her condition, full stop. Now it's written over here, follow up after a week with repeat ECG. So I will say we would, because again we are just writing in passive, so it's better to say we would. Okay, instead of we would review her with a repeat Okay, so now I've just written it over in view of the above that okay, fine, if you have Ms. Jagosh is being discharged back home on her request because it's written over here, I would greatly appreciate if you could monitor her condition, because that's the request I'm going to do with the GP, and we would review, because I'm going to review her, because the follow-up visit is after a week with a repeat ECG. You can just change the wording over here also, after 1 week also you can write that there is no issue in that. Please note, she has to take this and this lifelong. I have just reused the synonym, but you can also mention it. Okay, fine, because see, it's not written clearly whether she have to take this Rovista or this lifelong or not. So I have just mentioned this above medication, that this two medications she have to take it for a lifelong, that the patient, the GP do not stop this medication. Okay, if you want, you can just write here also. Okay, fine, please note, or yeah, that okay, fine, please continue clopidogrel, like the first I was just writing clopidogrel and aspirin lifelong, along with Rovistan Entacard. Okay, um, you can write that also, because that's not clear if the later medicine that you have to take it uh, you know for lifelong or not. Now the other way you can just write this letter is okay, so if you would just see the pattern. First is the introduction. In the introduction, I have written the name of the patient, what I am doing with the patient, or with what she has been, she has been discharged, and the condition that she has been treated for. Okay, and the article I will just share it in the group, Hania. I will inshallah share the folder with you. But the article, you have to write when you're writing the body parts. Okay, and you are writing the departments. There you have to must write the before them. Okay, and the first paragraph is we are writing the day she came to the hospital and why she was admitted. The second paragraph is what, um, about the what happened in the hospital. Okay, and if we will see, we can see that 2 days she stayed in the hospital, that is 15th and 16th and the 17th, like 3 days she was in the hospital. So the following day, that is the 15th, I just wrote this, and then 2 days later, like 16 and 17, 2 days later, this was her 17. So 2 days later, I have mentioned this condition also over here. Okay, so I have made one paragraph of a hospital. One was the day of her presentation when she came and we admitted her, and the treatment we gave her that day, along with the investigation. If you will just see that, okay, fine, this ECG prominent, this it showed this, and here it was, see, ECG was repeated, or this. No, where is the 15th? Where is the 14th? Yes, okay. ECG prominent, this. So there is no need to write, okay, fine, ECG was ordered or ECG was advised and her ECG revealed that. No, try to save your words. Okay, try to save your words. Now, if you will see that, okay, fine, I'm having 312 words. If I just, remove this, because this is not going to count. This will not going to count. But if you want to make it more concise and compact, you can just skip this 2 lines, 2 days later. Okay, you can skip this line, because now, okay, fine, I have written the today's visit where it's showing everything. Now, how you can write the other one? This one, as I have told you already, on the following day, Ms. Jagosh chest pain increased along with slurred speech. ECG showed ST elevation in leads 1, AVL and VS and V6. Therefore, her oxygen was increased to 15 liter, and clopidogrel and aspirin 150 mg were commenced. Okay, 2 days later, that I have mentioned over here. Okay, fine. I have this 2 days later, the same thing. Her condition improved, and improved with prominent this is, however, her ECG showed this. Now I have written about the today's visit. In this today's visit, I have also mentioned the discharge plan, that this is the plan I am discharging, because I am a cardiologist, and I'm discharging with this discharge plan. Okay, fine. Today her echo revealed an ejection fraction of more than 50%, and she is stable, full stop. She has been advised to quit smoking and alcohol consumption. Okay, beside consuming a diet low in this. That's the same. It was given in above also. Okay, and she has been prescribed to take this medications, Rovistan, this Eckhard once daily. Now, in view of the above, I'm just writing. Okay, if you want, you can write here also. You can add one more line. Please encourage her for the DASH diet. Okay, yeah, please note. Okay, fine. Please encourage her for the DASH diet. You can write it over here. But when this plan, I am, because I have advised her that, therefore I'm not writing it over here. But if I would have not written this one thing over here, then I will just write it over here, because then I will ask the GP to advise her, or ask the or to monitor, or ask the patient to be compliant with the advices that has been given, or with a diet, or with a medication. So this is one of the way. And another way which we can write is, in view of the above, Ms. Jagosh is being discharged back on her request with an overall improved condition. I found it unnecessary to repeat words, because I have written it over here. She is stable. Okay. She has been prescribed this is medication, along with 15 to 30 minutes walk every day. Smoking and alcohol cessation is advised. Please encourage her for DASH diet, and please note that she have to take this medication for lifetime or lifelong. Okay, so these are the two ways which you can write, that you will just write more details in the last paragraph, that is the in view of the above. But in my opinion, I would say that it's better to write the ending or the conclusion precise. Okay, just write the request, why you are referring it to the GP. Now I was just writing this letter to a GP, therefore I didn't include her medical condition. Moreover, she was being discharged. When she is being discharged, it means that she is being discharged to her GP. Okay, but if in the same way you are going to write a referral letter also, then you will write, if you are just going to write to anyone, uh, for example, if you are just writing this kind of a letter to a cardiologist, I am a GP, then yes, I will mention the medical history as well, and if there is any diagnosis or anything done. Okay, now as I was writing, and whenever you are writing a letter, just make sure to which doctor you are writing. So then you can just filter the information, because there are lot of information in the card. But if the doctor is, for example, it's a GP, then I don't have any any concern that I will be very much concerned about this leads in which she was having this ST elevation, although I can write this also, and I will not be concerned, okay fine, how much oxygen and this was given, because that is beyond my expertise. Because for every a GP, always for further investigate treatment, they refer it to the consultant. So a consultant is writing to a GP. But if you were a GP and you were writing to a cardiologist, for example, then it's necessary, or it's a must, to mention these leads also, how much oxygen was given, what was reduced, what was not reduced, because that is of the doctor's concern. So this is the pattern of the discharge letter: introduction, admission, hospital, then the today's, and then in view of the above, then you will just conclude the letter. Update letter is same as this discharge letter. Uh, yes, again, update letter is again, same as the discharge letter. I will just find one update letter also, and I will inshallah try to do that also, but it's same, because again also it's again you are just going to refer the patient to the GP. You are going to refer the patient back to the GP. Again, the patient was referred to you because the GP suspected something. Because I just remember one case which I always give to my students, that is of I think so, the patient was having a meningitis or something. The GP suspected that she might be having meningitis, and then she was referred to the neurologist or something, the emergency department, and where she was treated for treated for this meningitis. So the introduction will be more of the same. Okay, I'm writing to update you regarding this, who has been treated, या फिर who was admitted in the hospital, or who has been treated and responded well to the treatment of meningitis, something like that. She is now doing well, and I'm just going to refer her it further care. Again, when she came, what happened with her in the hospital, what I did. And again, the last paragraph will be long because I will be asking the GP to take care of that patient, the advices, what he have to monitor. So it's one or less the same, but inshallah I will try to do that as well. If you have any questions regarding this letter, you can just ask me. And if you will just see that I have written all the letter in past, because nothing is in past, and I have not written this letter in any complex grammar. Like, I see many people writing letter in have, had, has, had, this, had, that, had. You can make the letter easy. Okay, because I have not used any complex language over here. I have just mentioned whatever was mentioned here, as I was writing over here this epigastric pain, and this first I just wrote that, okay, fine, she was having a left sided chest pain. Then I said, oh, then I just erased this and wrote heaviness before pain. Because if I would, what I see in most of the letters, when they will be writing, find department which she was having this left pain, which were chest left pain, which was radiating to this, along with heaviness in the chest. Okay, when you are going to write, okay, fine, you are writing something which is going to further describe that thing, then it's better to write something which you are not going to describe before, instead of repeating again the, okay, that the pain was radiating to the left arm, the chest pain was radiating, instead of prolonging the sentence. Instead of prolonging the sentence, you can just write it in a short sentence. Okay, write heaviness before, and then write the pain. As you can, when I was writing, I just wrote the chest pain because it's very familiar. When I write the history of the patient, I always write pain. But then I said, then I see the case note. Okay, fine, it's there is more detail about that pain. Then okay, fine, and again, instead of writing and comma and using 3 4 ands in one sentence, it's better to write along with, along, or as well as. Okay, and again, then on examination, she had air hunger. Instead of air hunger, you can write, okay, shortness of breath. Because if you just if you just go further down, you can see over here, shortness of breath was improved. Okay, air hunger is again shortness of breath. Okay, you can just write, and again, I think so I saw it somewhere else also, because shortness of breath will also come, you can write over. She had what shortness of breath along with tachycardia, shortness of breath and tachycardia along with this. You can write, okay, she was having shortness of breath along with tachycardia as well as hypoxia. She was started on this morphine, and this is ECG was revealed, and this was done. As a result, she was shifted to CCU for further monitoring. Uh, One of the student just wrote the letter, and she was shifted to CCU. That is also correct. For further monitoring, if you want to write, you can write. If you want to skip, you can skip that also. Okay, but it looks nice. Okay, the following day, again, you can write the date also. On 15th, you can write, or you can write, okay, the next day, or you can write on 15th. And then here also, instead of 2 days later, you can just write it on 17th. But again, I just say one thing to my students is that just write a letter in a way that you are telling a story. And when we just narrate a story, we do not mention so many dates. We just say, okay, 2 days later, 10 days later, fortnightly, this, something like that. We just and if you will just read this letter, it will go in a in a sequence. The fluency is maintained. There is nothing upside down. Everything is in a sequence, and it's just so fluent and easy. you know there is nothing, okay, fine, that, okay, if something has been missed, and it has been, or it's breaking the tempo of the letter. It's not like that. So I've just mentioned this 2 days later, so you can do that also. And again, instead of writing date, because I have mentioned the date over here, and it is also written in the card. Okay, so I just wrote it, okay, fine, here today, this, then I just mentioned these things over here. And many people also get confused in this discharge plan. They say that, okay, fine, this the most common question I've been asked is that, okay, fine, this discharge plan, we are doing it, or the doctor we are referring to will do it. I always say that you are discharging the patient, so you will discharge the patient with a plan. When usually we work in a hospital, and a plan has been made. When the patient gets admit, we have a case file, then we just give our HOs or the doctors on duty, okay fine, this is the plan, and then we will discharge after her vitals are this, then just discharge her. So that is your plan, that you have made that plan. Okay, but something like the drugs, you have comment the patient on the medication, so you will mention that I have done that thing. The things that, okay, advice on this, okay, then you have advised. It's not like that you will just say, okay, say the patient, okay fine, this is your update letter, just go to your GP and he will tell you what to do next. No, you don't do like that. So the discharge plan is your plan that you have made before discharging the patient, because you're writing this letter at the time when the patient is still in the hospital but is now ready to be getting discharged. So this discharge plan is your plan, but also you can, like, encourage dash diet. I have written over here, okay, then she has been advised to quit smoking alcohol consumption beside this, but you can also ask the GP to, okay fine, please encourage her to take what kind of a diet is this dash diet. You can write in the end also, in view of the above, when you are just summarizing everything to the GP, you can also write, okay, please encourage her for the dash diet. Please note, as I have seen written over here, please note she has to take this medicine lifelong. So it means that the GP do not stop this medication. I was unsure about this Rovista and Atacard. Otherwise, I would have mentioned it over here. Please note that she has to take this. This is lifelong, along with Rovista and Atacard. This. If I was not for example, she has been prescribed to take Rovista this. If I was not going to write this line over here in this paragraph, then I would have included this line over here. Please note she has to take this. This is lifelong, along with Rovista 2 mg every night and Atacard 10 mg once daily. I can write this over here also, but I just felt comfortable. Okay, fine. Just, okay, fine. I have mentioned it over here that, okay, fine. She has been prescribed this is thing. Okay, and now what the GP has to do, that GP has to keep in mind that, okay fine, this two medication she has to take lifelong. Otherwise, you can mention this also over here. If you want to make, again, if you want to save your number, word count, you can mention here. Please note she has to take clopidogrel and aspirin lifelong, along with Robusta 2 mg every night, and this medication. And if you want, you can just skip this also. The dosage also you can skip, because again, I'm a GP. I have given this patient prescription. But again, if you're just writing in the end, it's better to mention. But if you want, you can skip. They will not cut your marks. But again, it's better to write this, because if you are just, because I'm not writing the dosage of this too. So I've just told the patient that, okay, fine, she has to take this, and this. So if you have any questions, you can ask me, because again, this meeting is going to end, or I will just end this meeting. I hope there is no confusion, and you can just go just read this letter.
डॉक्टर हिना
जी, yes.
मुझे आपसे दो क्वेश्चन करने हैं. एक तो जो इन्वेस्टिगेशंस लिखी होती हैं, जैसे फुल ब्लड काउंट, ESR एंड और एक्सेट्रा, तो हमें उनको रेलिवेंट इन्वेस्टिगेशंस लिखना चाहिए, या वन बाय वन एवरी इन्वेस्टिगेशन मार्क करके लिखें अगर वो पॉजिटिव हैं, लाइक सिग्निफिकेंट हैं?
आप उसका लिख सकते हो. ओके फाइन, ठीक है. आप ये लिख सकते हैं कि अगर जैसे अगर बहुत सारी इन्वेस्टिगेशंस हैं, जैसे 10-15 इन्वेस्टिगेशन है, तो आप उसकी लैब्स आप उसको डीरेंज्ड कर दो. ठीक है. उसमें फिर जो है, उसमें जो सिग्निफिकेंट है ना, बहुत ज्यादा, जो अगर फॉर एग्जांपल आप अगर जैसे आप जैसे कार्डियोलॉजिस्ट को भेज रहे हो, आपके पास, ठीक है ना, तो उसमें जो सिग्निफिकेंट है, जैसे ESR हो गया, मेरा सिग्निफिकेंट है, D डायमर मेरा सिग्निफिकेंट है, क्योंकि वो मेरे डायग्नोसिस से सिग्निफिकेंट है, तो वो मैं मेंशन कर दूंगी.
ठीक है,
फाइन ठीक
perfect.
है ये वो। अगेन
हाँ हाँ
आपने क्या करना है, आपने अपना सेंटेंस ऐसे कंस्ट्रक्ट करना है कि वो
जी
उसमें वो जो है ना एक फ्लुएंसी आए, ऐसा ना लगे
हाँ
कि यार इतनी सारी लैब्स आ गई मुझे तो समझ ही नहीं आ रहा है
हाँ
कहाँ से क्या गया।
हाँ, जी
ठीक
जी
है,
जी,
उसमें से
सही है,
प्रोमिनेंट वो शेयर कर दें आप।
निकाल के कर देंगे, ठीक है।
हाँ
और दूसरा क्वेश्चन ये है कि जैसे फाइंडिंग्स लिखी हुई होती हैं अल्ट्रासाउंड की, जैसे थ्रोम्बस है डीवीटी के लिए, तो वो पूरा डिटेल में लिखा हुआ था कि थ्रोम्बस 4 सेंटीमीटर इन दिस वेन, देन बिलो नी क्रीज। तो क्या मैं सिर्फ इतना लिख सकती हूँ कि डीवीटी इज डायग्नोस्ड बेस्ड ऑन दिस अल्ट्रासाउंड फाइंडिंग व्हिच हैज शोड 4 सेंटीमीटर थ्रोम्बस इन दिस वेन, दैट्स ऑल? या पूरी फाइंडिंग हम लिखें जो भी लिखी हुई है, सच एज
आप वो लेटर
अल्ट्रासाउंड
किसको
स्कैन?
लिख रही थी, लिख किसको रही थी वो लेटर?
हाँ, वो जीपी को लिख रही थी मैं, ऑफ कोर्स।
हाँ तो जीपी को लिख रही थी तो फिर इतना सब कुछ
तो
लिखने
उसको,
की जरूरत नहीं है।
हाँ तो फिर
जो
जरूरत नहीं है
डायग्नोस
ना
हो
लिखने
चुका
की।
है ना, जैसे फॉर एग्जांपल
जी
ये वाला डिस्चार्ज का है, अभी जैसे मैं जैसे आप जीपी को अगर वापस उसको
हाँ
वो कर रही हो ना, उसकी केयर में आप वापस उसको
जी
डिस्चार्ज
जी
कर रही हो, तो आपने
जी,
सिर्फ सिंपल बता देना है कि ओके फाइन ठीक है, जो बेसिक जो है ना उसका ये था
वो
इन्वेस्टिगेशन,
इतना था, हाँ
उसमें जो है
एग्जैक्टली,
ना इसका अल्ट्रासाउंड पे रिवील आया था कि इसको जो है ना डी वेस थ्रोम्बोसिस है इन मल्टीपल
ठीक है,
वेन्स और इन इन पर्टिकुलर इन
हाँ
दैट वे। जरूरी नहीं है
ठीक
अभी
है,
कि
ओके,
डिटेल्स लिखो जीपी
जरूरी
को।
नहीं कि पूरा लिखे, हाँ। अच्छा,
हाँ
और एक लास्ट क्वेश्चन है कि सपोज मैं किसी को भेज रही हूँ पेशेंट को, जैसे फिजियोथेरेपी के लिए या रिहैब के लिए, तो उस लेटर में कुछ डिफरेंस होगा? लाइक उसमें तो फिर मैं इतनी मेडिकल डिटेल्स नहीं डालूंगी ना इन्वेस्टिगेशंस की, और आई एम जस्ट सेंडिंग द पेशेंट फॉर रिहैबिलिटेशन और फिजियोथेरेपी, तो
आप
उससे
उसमें
रिलेटेड जो
कॉज
रेलिवेंट होगा
लिखोगे,
बस
फिर
वही
आप
डालूंगी।
उसमें
हाँ
आप जो है मैंने पहले के अभी ना आप देखना ग्रुप में या चैनल पे ही देखना, उसमें ना 2 रेफरल लेटर्स मैंने लिखवाए हैं पहले के, ठीक है। आप जब
जी,
वो आपका फिर रेफरल लेटर होगा, रेफरल लेटर में आप उसकी पास्ट मेडिकल हिस्ट्री, सोशल हिस्ट्री, हर चीज मेंशन करोगे, वो भी
ठीक
रेलेवेंट
है,
करोगे। जैसे अगर
ठीक
फिजियोथेरेपिस्ट
है,
को भी आप कर रहे हो ना, तो आप उसको बताओगे
हाँ
कि ठीक है इसको बैक स्ट्रेन हुआ था, उसके लिए उसने ये मेडिकेशन ली थी, या फिर इस चीज के लिए ये एलर्जिक है या कुछ है इस मेडिकेशन का, वो आप मेंशन करोगे आप जिस डॉक्टर को वो कर रहे हो। हाँ लेकिन जब आप जीपी को भेजते हो तो फिर आप उस टाइम पे कुछ अपनी उसके पास्ट मेडिकल या सोशल या
हम्म,
कोई भी हिस्ट्री आप मेंशन नहीं
कुछ भी
करते।
नहीं लिखते, ठीक
कुछ
है, ओके ओके, थैंक यू, थैंक यू।
नहीं। हानिया इंशाल्लाह मैं आपको सारे लेटर्स करवा दूंगी। ट्रांसफर लेटर, अगेन ट्रांसफर लेटर भी सेम इसी तरह से ही होता है, क्योंकि वो ट्रांसफर लेटर क्या होता है, या तो आप उसको हॉस्पिटल में ही एक डिपार्टमेंट से दूसरे डिपार्टमेंट में ट्रांसफर कर रहे होते हो, या फिर यू आर जस्ट ट्रांसफरिंग द पेशेंट फ्रॉम वन डॉक्टर टू अनदर डॉक्टर। अगेन लाइक इफ आई एम ट्रांसफरिंग, आई एम अ कार्डियोलॉजिस्ट इन दिस एंड आई एम जस्ट ट्रांसफरिंग द पेशेंट टू द orthopedic, because for example the patient is having rheumatoid disease, okay, so rheumatic heart disease I have treated, now she's having rheumatoid arthritis, so I'm just going to refer it to the orthopedic doctor. So again the template will be the same, you have to just see the template, inshallah if I will get time I will do it. And okay, इसके बाद जो है इंशाल्लाह मुझे एक और कोई लेटर, एक मुझे मुश्किल किसी ने ग्रुप में शेयर किया था, वो भी एक मुश्किल लेटर था। इनफैक्ट मैंने डिस्चार्ज के 2 लेटर्स मैंने, क्योंकि मैं काफी टाइम से ना आई वाज जस्ट थिंकिंग कि मैं कौन सा डिस्चार्ज लेटर करूं जो कि किसी ने ना लिखा हुआ हो, और ये मेरे अपने लेटर्स थे जो कि मैं ढूंढ रही थी कि ओके फाइन ठीक है मैं किस तरह से उसको वो करूं। सो एक और, इफ यू आर इंटरेस्टेड वी कैन डू वन मोर डिस्चार्ज लेटर, ओके, इन द नेक्स्ट विजिट। वो भी मेरा लिखा हुआ लेटर है, ठीक है, जो कि मैंने अपना चेक करवाया था। सो if I will get time, we will do one more discharge letter. So फिर inshallah channel पे 2 discharge letter, 2 refer letter, and 1 inshallah transfer letter and 1 update letter. Again, the update letter will be same as this. You can just watch the video and get an idea of the template. But inshallah, whenever I will get time, I will do it. Any other questions? Okay, I will end the meeting and share the recording in the group, inshallah. Have a nice day. Thank you. Bye.